scientist to Northeast ICMR. I have been associated with an organization that works for cancer. This is Fertility Cancer and Palliative Trust since 2017. So as a person, I'm a cancer researcher and as well as working with Fertility Honorary Program Director. Our role is in overall comprehensive cancer care in the community. We have a state level cancer awareness program. Then we do provide support for screening. So far as Government of India's guidelines, 3 cancer screenings are done. This is for oral cancer, breast cancer and cervical cancer. Today this camp is related to cervical cancer. This is the second most cancer in female, where every 8 minutes one woman die of this disease. So there is only one vaccine so far to prevent cancer. As we are aware that human papilloma virus is the cause of this cancer, so there was development of vaccine. Earlier the vaccine was available, but it was not produced in India, so it was very costly. It was produced, those brands were produced in USA. Now as Serum Institute of India has produced vaccines, which is you can see in the this is the vial where serotype 6, 11, 16, 18 are available, which can prevent 85% of HPV related cancer. Now as it is more cost effective, and British Cancer and Palliative Trust is a non-profit making organization, we are purchasing in a lower cost, and this vial is used for 2 girls. Now that is why the amount, the cost associated, which is much lesser than the earlier. Through this vaccination camp, our target is to cover large number of population. Then only the impact that we desire, that that will come down. Say after 20 years, if we are able to vaccinate 90% of these girls from 9 to 15 years, but we are covering up to 30 years here, because the Government of India guidelines in community is from 30 years there should be screening. So before that, whoever is willing to take, we are offering this vaccine with Indian Medical Association and Federation of Obstetrics and Gynecological Society of India. So we have done 500 vaccinations so far for this age group, and for 9 to 15 years, 2 doses are enough. But for above that age group, 3 doses are required. For 2 doses, if today is a 0 dose, after 6 months, second dose is required. For others, it is today is a 0 dose, then after 2 months and after 6 months. As you are aware, Northeast is also called capital of cancer, because if 1 person out of 10 person develop cancer in average in India, but someone from the Northeast, say today we are sitting in the capital of Assam, the district is Kamrup Metro. So 1 person every 4 or 5 person develop cancer, which means we have double the numbers of cancer than the national average. So our emphasis should be, our preparation should be much more than the rest of India. So all of us should actually extend our support, because anyone of us might be suffering from cancer, not only cervical cancer. So overall, we also work on breast cancer. We provide support to the treatment, as well as these are mostly community oriented work, so that it is an inclusive one. Those who cannot afford, we shall also be, we have started providing those who cannot afford, those already their family members suffered from cancer or died from cancer, their girls will be receiving at least 1 dose of vaccine free of cost. Now the study have shown, even someone is giving single dose of vaccine, that will also prevent 80% of chance of developing cancer. So this is the plan we have with us. Thank you.
Ma'am, I ask you a question. So why the cancer is growing in the female cervical cancer and breast cancer? Why?
Dr. Pankaj, you have a question.
Sir, I ask you a question. Why is the cervical cancer and breast cancer is growing in the female cancer?
Why cervical cancer and
Breast cancer growth in the female candidate? Why?
it is not
Any
that,
deficiency?
no. Cervical cancer is mainly HPV, that's the virus called human papilloma virus. That is mostly 99.9% of the cervical cancer is because of the human papilloma virus. And that infection lead to cervical cancer. But irony is that generally it's a sexually transmitted disease, and from male part they get the virus infection. Male part the female exposes to the virus, but generally in male there is symptom, but in female if there is a prolonged infection then it will lead to cervical cancer.
হয় আপোনালোকে শুনি আছে আপোনালোকে চাই আছে ইউটিউব চেনেল দীপক বৈশ্য আৰু আপোনাৰ চাৰ্ভাইকেল কেঞ্চাৰ আৰু ব্ৰেষ্ট কেঞ্চাৰৰ ওপৰত আপোনালোকে ছাৰৰ পৰা আপোনালোকে শুনিলে আপোনাক দেখুৱাইছোঁ।
I am Dr. Pankaj Deka. I am gynec oncosurgeon associated with Health City Hospital and in Guwahati, and I am an active member of Proticity Cancer and Palliative Care Trust. And today's drive is basically to vaccinate the female, mostly the girl, regarding the most dreaded disease actually, this is the cervical cancer. The cervical cancer, for general knowledge, actually it's an infection caused by human papilloma virus. That is a viral infection, and irony is that most of the infection the lady got or the girl got, that is from the male counterpart. It's a sexually transmitted disease, and most of the infection got from the male part. But in female, if the infection is prolonged, that persists for quite some time, then it ultimately leads to development of the cervical cancer. And in the worldwide, almost 80% of the cervical cancer is from underdeveloped countries. In developed countries, the incidence is quite low now, and it is because of their vaccination, and before that there is a screening. There's a simple screening method that is called the pap smear. They regularly do the pap smear in developed countries. Every 6 months, all the girls, all the ladies, generally ladies, they do the pap smear. But in our part, in our countries, because of the poverty, because of the lack of education, generally those drives are not there. Generally females, they do not go for pap smear regularly. But the vaccine gives a promising effect in this side, because if we can vaccinate a girl before the age of 15 or 16, when there is no exposure to sexual exposure, then generally it gives a protection of around 98%. So if we vaccinate a girl before the age of 16, almost 98% protection against the cervical cancer. We have to give 2 or 3 doses depending on her age. So if we vaccinate properly, proper time, then 98% protection against the cervical cancer. And before that, after that also, up to the age of 26, we can vaccinate the girl. And before, if she get married, or then again we have to educate the girl regarding her sexual practices, multiple sexual partner. All these are the ultimately lead to the cervical cancer. So if we educate the girl regarding those factors, then definitely one day we can eradicate cervical cancer. And this vaccine, this virus is not responsible for only cervical cancer. It also causes the anal cancer, oral cancer. All these are related to this human papilloma virus. So by vaccinating the girl, we can prevent not only cervical cancer, multiple other cancer also can be prevented. So it is very important to vaccinate our girls before the age of 16 if possible, if not up to the age of 26, with 3 doses of cervical cancer vaccine.